If you've ever had that nagging chronic pain in your back or your joints, you get to a point where you're facing this huge decision. It's a real crossroads, and it can affect your health, your wallet, and just your life for years to come. Do you go under the knife, or is there another way? Well, today, let's really get into it and unpack the true story behind physiotherapy versus surgery. Here's how we're going to break it all down. First, we'll look at that initial dilemma: pain, pills, or a procedure. Then, we'll dive into the power of movement with physiotherapy. We'll also cover when surgery is actually the right call. After that, we'll put them head to head with some hard data. And finally, we'll pull it all together so you can feel confident making the right choice for you. All right, let's jump in. Section 1. Pain, pills, or procedures. This isn't some small question. It's a high-stakes choice that millions of people are wrestling with every single day. So there it is, that pain that just won't quit. What's the next step? You really are at a crossroads. Do you try to manage it? Do you move through it? Or do you opt for a surgical fix? Every single one of those paths has its own map of risks, costs, and of course, potential rewards. For a ton of people, the journey starts right here with something like a non-steroidal anti-inflammatory drug, an NSAID. And yeah, they can give you some relief in the short term, but let's be clear, it's often just a band-aid. In fact, some of the data is pretty startling. NSAIDs are actually responsible for a whopping 30% of hospital admissions for bad drug reactions. We're talking serious issues like gastrointestinal bleeding, heart attacks, and even kidney damage. That's a huge risk, and it's why so many people start looking for a better, more long-term solution. And that search for a better solution brings us right to Section 2, the power of movement. Let's really understand this first major option, the proactive, non-invasive world of physiotherapy. So what is physiotherapy, really? Well, at its heart, it's all about getting your body moving and working the way it's supposed to. It's not just a list of exercises. It's a whole approach that uses specific movements, hands-on therapy, and, this part is key, education, to help you understand your own body. The goal isn't just to stop the pain now, but to stop it from coming back. There's a great little saying in the physio world: motion is lotion. I love that. It perfectly captures the idea that movement itself is like medicine for your joints. It helps lubricate everything, it cuts down on stiffness, and it just gets your body back in business. And this is what a good physio program is all about. Sure, it's about restoring motion in the joints, but it's also about building up the muscles that support those joints. It's about correcting the very way you walk, run, and bend. By doing all that, it becomes this amazing preventative tool, which means you can finally start reducing your need for those pain pills we talked about earlier. Okay, so let's switch gears and head into Section 3. Now we need to look at that other major path, surgical intervention, and figure out when it's truly the necessary choice. Now, here's the thing you have to understand. Surgery usually isn't option number one. It's a powerful but reactive solution. It's for very specific situations. Think about a knee that's completely worn down, just bone on bone from arthritis, or a ligament that's been torn clean through. We're talking about major structural damage, where less invasive options like physio just haven't been enough to solve the root problem. And if you do go down the surgical path, it's a real journey. It starts with the diagnosis and the decision, then you've got all the prep before the operation, and then the procedure itself. But look at that last step, post-surgical rehab. This is where those two separate paths we've been talking about suddenly meet. Because even if you get the surgery, your road back to feeling 100% almost always runs straight through physiotherapy. It is absolutely essential. Post-op PT helps get the blood flowing to heal you up faster, it helps you get your mobility back, and it actively works to prevent some really serious complications, like blood clots or having your muscles waste away. So you see, physiotherapy isn't just an alternative to surgery. In many cases, it's a critical partner to it. Which brings us to the big showdown in Section 4, physio versus surgery, by the numbers. Let's get into the hard data on what these two approaches actually cost and what kind of results you can expect. First things first, let's talk about what's on everyone's mind: money. We're going to look at some numbers out of India that paint a really stark picture of the upfront financial hit for each treatment. Okay, so let's start with physiotherapy. For a full 3-month plan to treat a chronic condition, you're looking at a total cost of around 45,000 Indian rupees. Got that number? 45,000. Now take a deep breath. For a single knee replacement surgery in a major Indian city, the potential upfront cost could be as high as 600,000 rupees. The difference is it's massive, isn't it? I mean, you can just see it right there. The cost of physio is just a tiny fraction of the cost of surgery. But the financial story doesn't stop with that first bill. Right, it's not just about what you pay up front. A study on low back pain from Pakistan found that the indirect costs were way lower with physio too. The folks in the physiotherapy group lost less than half the number of work days compared to the other group. We're talking about 5 days off work versus almost 12. For most people, that's a huge difference in lost wages and productivity. Okay, so this is the million-dollar question, right? Physio is cheaper, but does it actually work as well? Well, according to a major analysis from 2017 in the British Medical Journal, which looked at 13 different studies, the answer is a resounding yes. For people with arthritis in their knees and back, physical rehab was found to be just as effective as surgery at relieving pain and getting them back on their feet. So, with all of that on the table, we land at our final section, making the right choice. This is all about taking this information and using it to make the best possible decisions for your own health. Think of this as your checklist for your next doctor's appointment. You need to talk about medical necessity. Is surgery truly the only option? You need to be honest about the severity of your condition and, of course, the economic factors for you and your family. But also, what are your goals? Are you trying to get back to running marathons or just walk to the mailbox without pain? All of this plays into your long-term health strategy. So when you boil it all down, it really comes to this. Physiotherapy is proactive. It's a long-term investment in how your body works and in preventing problems down the road. Surgery is reactive. It's a powerful and sometimes necessary tool for fixing big structural problems when other options haven't worked. And that really leaves us with one final thought. When it comes to your health and your body, are you looking to invest in building a strong foundation? Or are you just patching up the cracks as they show up? At the end of the day, that choice is yours to